Hello, and thank you for joining us for our webinar, The Art and Science of Finding Great Clinicians. Before we get started, a quick reminder that today's webinar is pre-approved for one general recertification credit hour through the HR Certification Institute. To receive your certificate, you must be logged in so we can verify your attendance, and the certificate will be emailed to the email address provided during registration. The certificate with the program ID as well as access to the recorded webinar will be emailed to you early next week. I'm Stephanie Gilbert from Health Callings, and we are proud to be sponsoring today's webinar with Healthy Careers. Health Callings and Healthy Careers are both part of the DICE Holdings family of career sites and are the leading healthcare-focused job boards. Our 100% focus on the healthcare industry and association partnerships help us to provide unparalleled access to healthcare job seekers across all disciplines and specialties. Coupled with best-in-class tools and customer service, we make it easy to find your next hire faster. In addition to being the leading solution for healthcare HR professionals and recruiters, we also seek to provide you with information and tools that improve your ability to do your job. So we're pleased to be sponsoring today's webinar presented by Jan Hunter, Principal of Workforce Design. Jan is a recognized collaborative thought leader and featured speaker focused on workforce development and engagement. She is a past speaker at ASHRA, the Towers Watson Client Conference, TMA's People in Healthcare, and most recently for HR.com. One final housekeeping item before we get started. Due to the number of participants on today's call, all lines are muted for the whole duration. There will be an opportunity for Jan to answer questions following the presentation. You may submit questions at any time through the chat box, and they will be answered at the end of the webinar in the order they are received. Today's webinar will last about an hour, and we're glad you chose to join us. Now, without further delay, I'll turn it over to Jan for today's presentation.
Thanks, Stephanie. Welcome, everyone. I hope that you are staying warm and cozy wherever you're at today. I am presently in Scottsdale, Arizona. I know everybody is very jealous that it's going to reach a high of 70 here, so I'm inviting you to come down and join me here. It's absolutely beautiful, but I hope where you're at, you're warm and safe. As Stephanie mentioned, we do have a very big audience today, and we have a lot of information to cover, and it's going to feel like we go, I think, kind of quickly. So I just wanted to let you know that my contact information is at the end of the presentation, and if you have any questions after this broadcast, you're more than welcome to email me directly, and I'd be happy to answer any questions that you might have. So what we're going to talk about today is some overviews of healthcare trends that I've been seeing and that I think will be impacting our ability to get talent and the kind of talent that we're going to need. The Accountable Care Act and how that's driving new behaviors and workforce skills. Now, these may be expectations that we've had previously, but we're really going to be held accountable for them now. So they've become even more important to us as we look for the talent that we need. We'll talk about the healthcare recruitment process, some trends that I'm seeing, some ways that we can make that process even better. And then last but not least, we'll talk about a quick way to get there. As you want to move through your journey of making your recruitment process impactful and also attracting the right kind of clinicians. Let me back up by saying that I spent, and Stephanie gave me a very nice introduction, which I appreciate. I did spend about 10 years in healthcare HR, once for a small and integrated acute care healthcare system in California, and then for a larger multi-hospital system in Arizona. And now I'm focusing my career on workforce development. I'm directing the CareerStat project, which is frontline healthcare workforce. For the purposes of today, when we talk about clinicians, I'm speaking about those who are licensed in some way to provide patient care. So just so everybody's on the same page with which group of people we're talking about, it could be anybody from a surgical tech to a physician, because those are the folks that are going to be in great demand as we go forward. So let's talk a little bit about the healthcare trends that I've been seeing and reading a lot about. First of all, everybody's heard of STEM, but if you haven't, STEM is science, technology, engineering, and math. And these services and occupations will be growing at a rapid rate. These are occupations that provide high levels of post-secondary education. And as you note on the bottom there, my source is Georgetown University Public Policy Institute. When they look at trends, and I'm going to go ahead and click through these are trends that are going to impact not only healthcare, but they're also going to impact other businesses across the U.S. because most companies are saying that they need these kinds of skills. So what this means to us is we're not only competing with healthcare employers for the right clinicians, we're competing with high technology, we're competing with manufacturing, energy, and those that we can't even envision at the current day that will be emerging. And again, it just makes our job as recruitment and recruiters and HR leaders even more challenging in recruiting and retaining these folks. The other thing that really stood out to me, I don't know if everyone saw last week's jobs numbers, the reports on unemployment. Even though we've had sort of a jobless recovery, most data scientists are still predicting that there will be a significant number of new jobs between now and 2020 and a significant number of job openings, which tells me there's going to be quite a bit of churn. The other thing that they're predicting is most of these jobs will either require an associate's degree or a bachelor's degree. And as you look at the last bullet there, healthcare is still going to be the leading employer in this job growth recovery. So it just, says to me that we're facing challenges in this arena that we'll need to be facing. This doesn't, in my view, mean job security for the current workforce because many of them were trained prior to ACA being even something we were considering. And so it doesn't mean job security because we'll be looking for the right person, not just a person, because it begins to impact our pay, how we're reimbursed, the way we accrue revenue. So all those things are really changing, and the job market is going to play a key factor in that. We've talked a lot about ACA, or I've been thinking a lot about ACA and the changes on healthcare delivery. Even with the aging population, this is still a leading indicator for the economy. And and the fact that the Affordable Care Act requires that everyone be insured is going to drive growth in healthcare spending and really test our ability to provide care to a new group of folks who maybe haven't had health care insurance before and they didn't seek treatment because they couldn't afford it for a variety of either chronic diseases or issues that they were having. So this can really stretch our capacity to provide this information or this treatment for these individuals. And what that says to me is that it's going to really drive an uptick in the number of people that we're going to need to employ at different levels of the organization. The shape of the workforce will change based on where the access for the care is being accessed. So whether it be a primary care setting, who provides that intake process, and the variety of the treatment is going to be changing. So really the entire shape of our workforces is changing based on this new healthcare delivery model. And we're not quite sure what this means across the board to our current populations and those that we need. So it's an unprecedented time, coupled with the fact that we know that the spending is going to increase just based on the fact that we have a population that's now insured that wasn't insured before. A couple things that I also found really interesting is if you look at this chart and you read it from the left to the right, you look from 1973 to 2020, the number of advanced degrees has stayed pretty steady. The growth has really been in the areas of having a high school diploma, the growth has really occurred in that associate's degree group, but it hasn't really shifted all that much. However, if you look at the advanced care models or the new emerging models, the amount of work being shifted around to different populations really speaks to the fact that we've got to do our level best to recruit the best and best fit across all levels. So previously, I think a lot of the efforts that I know I made when I was in workforce development in healthcare, and I see my peers making, is toward that advanced degree group. But really, we've got a lot of work to do across the entire spectrum. So the question comes, is there a healthcare shortage? And we've heard a lot about the nursing shortage, shortage of physicians, shortage of physical therapists and pharmacists. Yet we're also hearing that there's layoffs, there's delayering, and there's this glut of new grads. So the question always comes to me, is there a shortage of workforce? And the answer is, it depends upon the care delivery model that you have and your current population. We're still facing some mergers and closures. As a matter of fact, in 2012, according to PricewaterhouseCoopers, that was the busiest year in history in terms of mergers in healthcare. And that really hasn't slowed down completely. They're still on a monthly basis or a daily basis, different mergers, people partnering, people creating new business alliances to try to address the Accountable Care Act and the challenges that are being posed by that, the objectives that it has. So I don't see this slowing down. What that does is continue to really challenge us to know where are the real vacancies. As we've got all this turmoil in our organizational structures, the question says, is there a shortage? Do we have a surplus? That's, I think, the $50 million question. I don't think there is a surplus of worker because the skills and abilities that they need will be changing, and we'll be talking about that in a minute. But that is the $50 million question. So this is data from Health Callings, and Stephanie, jump in if I say anything that isn't correct about this data. But Stephanie provided information about the activity within the Health Callings and Healthy Careers website, so their postings. And I asked her...
Jan, I'm sorry. This information is actually from wantedanalytics.com, which is a site that pulls data from all job boards across all industries. So this will include Health Callings, Healthy Careers, and then your Career Builder and Beyond, and any job board that you could imagine, free or anything that's out there.
Okay, well, thank you for clarifying that. So this is a really good composition of kind of what's going on in the healthcare market. And so what I asked her to do was really look at the top 10 positions with the most openings currently and tell you a little bit about the number of employers advertising, or tell you a lot about the number of employers advertising, the available candidates for those open positions, and some other key data points like the average posting day, number of days open, and then she layered in growth rates from BLS.gov, and then education needed by each job type. So as you look at this, the stats don't really look that bad. We've got a number of current openings, and we've got a lot of available candidates. But what we don't know is, are these candidates able to perform in the current environment and the future environment? Many of the candidates that are on the job market today were trained in their educational program between a year and 35 years ago, before we ever even knew or thought about ACA being a possibility. So while they may clinically be very good, we don't know if they'll be able to perform successfully and help us as employers meet our objectives under ACA and other reform issues that may be coming down the road. So again, if you ask if there's a supply or oversupply of workers or an undersupply, if you just took this at face value, you'd think, boy, we don't have a problem. We've got a significant number of applicants for each open position. As a matter of fact, more than maybe we could ever need. But again, you have to think about, as we're looking for the right clinicians, are they going to be able to perform in this new environment? Okay, so let's talk a little bit about that new environment and what the expectations will be of these workers as we get rolling along with ACA. So there's been significant changes in the healthcare landscape, and we talked about those a little bit earlier on in this presentation. We are going from a market where we have some uninsured and maybe a significant of uninsured or underinsured individuals who are now, with the objective being, all insured. And so when you think about the fact that that group of people is growing, and again, they may have delayed or just not just not focused on their care or on issues that they might be having, and now they're all in the system with some kind of insurance or great insurance, there will be a pent-up demand of care that will be required, and that will either be sustained or rising with the aging population. So that's one big change coming our way. Stephanie, there we go. We've had a lot of electronic health records for a while, but they really haven't all completely been talking to one another, and we really haven't been required to make that a reality. So under this new law, we now have what is called integrated EHR, and clinicians can no longer say, I don't want to use that system or I won't use that system. They're all accountable in certain ways to entering information and accessing information through an EHR system, which is an electronic healthcare record, which again changes the skills and abilities that an individual needs to have in order to be successful in this environment. In the past, we've had an environment of specialization where you went into a discipline, you had that experience, you got that training, and that's what you did. Now the expectation is really changing, including the entire kind of being the jack of all trades, or the ability to work across multiple areas of specialty. And we're integrating behavioral health in a way that we haven't seen previously. They wanted to be at the table, they wanted to be involved, and with the new healthcare law, behavioral health becomes a big part of success because we're treating people's underlying behaviors that cause their disease or their chronic issues. And behavioral health professionals will be integrated in a way that they never have been before. The teaming environment and the transfer of information becomes critical. And those may be different skills and behaviors than the current population in healthcare has today. We're going from a fee-from-service environment to payment reform. And I don't really think we all have a sense for what that's going to look like. But it certainly is a different revenue model, which is very different than your typical healthcare worker thinks about. So again, that's going to require a different set of skills and behaviors. In the previous environment, I think, we had patient-driven care, we had some coordination, but really and truly in this new environment, the expectation is that we help drive behavior. We provide coaching and coordination for a patient's care. And that means integrating and teaming in a different way than we have when we were all in the acute care and inpatient environment. So that really drives a different way of looking at the behavioral and skill expectations that we need to be looking for as recruiters and HR leaders in healthcare. This is the old behavior where a healthcare worker would give information to a patient, and that was the end of their responsibility. Now we're expecting them to be actively listening, thinking on their feet, providing critical thinking, accessing resources, and really being an interactive two-way communicator with patients. Old healthcare mantra is follow the instructions, follow the protocol. New healthcare mantra is think, solve problems, be able to assess situations, and utilize out-of-the-box thinking, which again is very different than the way a lot of our clinicians were trained in their healthcare training program. We're going again from specialist to more generalist. We're going from treatment-based to prevention, again a very different way of interacting with a patient, a very different skill level and behavioral expectation. And finally, we go from caregiver to health coach. So again, expectations very different between giving care and coaching somebody toward improvement. So when we look at healthcare, we just spent a few minutes talking about the behavioral and skill expectations and the changing environment and all of those things that are going to be changing just for the healthcare worker. But as you look across just the U.S. workforce in general, things are really changing and the expectations are changing. So physically intensive skills are becoming less important. 48% of jobs require high degrees of active listening. And if you look at the trends in terms of Workforce 2020, it's really soft skills that are becoming more important. The technical skills, also very important, that most employers are looking for these things: leadership, communication, the ability to use analytics, and to provide administrative types of resources. So not only are we looking for these things in healthcare, but all of the other business and organizations around us are looking for the same thing, which means the landscape becomes really competitive, especially, and I know today we're focusing on clinicians, but as you look at the rest of your population of workforce, those that don't need clinical skills have an opportunity to work in pretty much any industry that they're interested in. So patient account representatives, marketing, sales, finance, IT, these are the skills that are in demand. And they're not only in demand in healthcare, but they're also in demand in other industries, making it even more important that we have a good recruitment process that gives us the advantage over other employers, and that we have a work environment that gives us an advantage over other employers. So when you think about all of the things we've been talking about, the question comes back, is there a healthcare shortage or a workforce shortage? And, again, I think that's the $50 million question. When you look back at the other slide that Stephanie provided, there appears to be a number of interested applicants looking for work. And there seems to be almost a large surplus. But when you drill down what you really need in the right healthcare worker, the question becomes, is that subset of that population available that can actually be successful in this new environment? And so you look at an equation that says, do I have the skills and behaviors to be successful in an accountable care environment? Are the current training programs available in education providing that mindset? Are they teaching those kinds of skills and behaviors, or are they teaching a model of clinical education that would have been successful a few years ago but wouldn't be training the individual to be successful today? And that's the unknown. I think most of our educators would like to move toward ensuring that their programs meet our needs, but they typically lag behind the changes that we're experiencing, and I'm sure you all know this from having worked in these areas before. So that's a variable that is very unknown. The competition that we've been talking about, we don't know, unfortunately, in a finite way, what the expectations and job growth will be in industries that surround ours that require the same skills. So that's an unknown variable. And then there's the whole patient population piece, because that's truly changing every day as people gain insurance, especially those that didn't have it before. We have our aging population whose expectations are going to be different as it relates to service and information sharing. So again, it's hard to pinpoint exactly what the workforce supply looks like, but I would make the case to say that with just the skills and behavior component, we've got some work to do as it relates to developing our workforce. So a little bit about the trends we've been talking about and what the impacts will likely be. So with all of the changes with ACA and the behavioral and skill expectations that are changing, it's likely that time to fill and cost to fill will go up. The reason being is that it will take longer and be more challenging to ferret out the right individual who has the clinical experience, the clinical training, and the behaviors and skills that we would expect and would need in order for them to be successful in this environment. So if you think back to the other slide that Stephanie provided where the ratios look really big, that's great on the one hand. On the other hand, that just means you've got a larger pool of people to sift through to come to those right individuals to drive your business the direction that you need it to go. So it's probably going to take longer and cost more to find the right individual. So what impact will this have on salaries? Well, I know, or I hope, some of you remember back to the nursing shortage back in the early, mid 2000s. When we had a shortage of workers, the very next thing that happened was our salaries went up and through the roof. And in some years, we saw double-digit increases in not only base compensation, but in other perquisites around that. For those high-demand positions, I would say that would be the expectation going forward as well. So we're going to see a shift in salaries where they've been pretty flat. We've enjoyed that the last couple of years. We're going to start to see a rise in salaries in the coming years. With all of the changes that are coming along, and with all of the financial constraints that we've seen as it relates to, what we can provide to our employers or our employees in terms of nice to-dos, a lot of those things have gotten kind of reduced or eliminated, and they're viewed as a takeaway. And so with that, we start to see engagement and retention going down, especially engagement. And I think that's the reality that's here to stay, because we can't really provide those nice to-dos anymore. The work environment is becoming more performance-driven. And so for those who've been in healthcare for a while, yes, we had performance outcomes, absolutely, but financial outcomes are even more and more important, and we're holding people accountable in a different way than we have in years past. So again, for those long-term healthcare workers, they either can adapt to that environment or they move on, retire, etc. And then the last impact, when you have reduced employee engagement and retention, it has, the same impact on your HCAHPS scores, what your patient is saying about their satisfaction, and typically revenue as well. So it does create a pretty challenging environment. So moving on and talking a little bit about the healthcare recruitment process. I think this is the place where, as HR professionals and recruitment professionals, we can play a pretty big, impactful role. So here's a typical recruitment process that I see. And I want to talk about this a little bit. This is actually a process that I'm quite familiar with. And there are processes that are shorter than this and processes that are longer than this. But this is a typical process. And as you can see, there's an average of 31 steps in this process, which is a lot of touch points with our applicants. You can typically include 15 to 20 interactions with the candidate, and it may be 10 to 15 different people talking to the applicant. Typical completion time is anywhere from 60 to 100 days, and it could include anywhere from 6 to 12 databases that contain valuable candidate information, which could help us potentially answer some of the questions that remained unanswered earlier in this presentation. So that's why I bring it up. Even with all of these touch points, we're still not able to get the data that we typically need to answer the key workforce questions that we might have. Here's a typical cost of this process. This is from PricewaterhouseCoopers, and this is an HR survey for healthcare employers only. They're saying that the cost of our current recruitment process is around $2,000 per hire. I would guess it's probably a little bit more than that, but that was their average survey number that they had from their 80 to 100 members that participate in their survey. And it's driving our costs up because we have so many touch points and different areas in this process that it's costing us more to do the same thing. And what does this mean when we have a vacancy? Well, if we can't fill a position, of course we're losing revenue, and if we can't serve our patients, again, our HCAHPS scores go down. So here's what it looks like from the view of a candidate. And I was in recruitment for quite a while, and one of the things that we talked a lot about was the candidate experience. But one of the things that we didn't talk about was what it actually cost a candidate to engage with us. We talked a lot about what our costs were and our time involved was, but there's a cost to the candidate. And I'm especially seeing this with the physician provider market and the way that they're looking at whether or not they're going to engage with a healthcare employer. So my last company, my office was right in the middle of physician recruitment, and I would hear these conversations going on outside my door, and I would hear the recruiter trying to address these concerns. So in any event, this is what a typical candidate will do in a typical healthcare HR recruitment process. They're going to spend 30 to 120 minutes completing an online application. And 120 minutes sounds kind of far-fetched, but I actually know quite a few healthcare employers who ask applicants to take an assessment before they ever talk to them. Those assessments can take, up to 2 hours. Then if their application is selected, they're going to spend another 30 to 60 minutes with the screener talking about the information that they just spent 30 minutes to 2 hours putting in a system. Then, if that goes well, they're asked to participate in a series of interviews, and I've seen it up to 16. That's the highest number I've found. 16 interviews for one position, for one individual for one position. And then if they're selected, they'll spend time negotiating an offer and a start date. So their total cost could be up to $1,600 out of their pocket in lost time just to participate in a recruitment process, and not really sure if they even want the job. So that's something we really need to consider as we think about our processes and how we're going to go about trying to find that one perfect person who's got the behaviors, the education, the skills, and the abilities that we want in our organization. It's not only costing us money, it costs our applicants money. And it leaves an impression with them that they're not shy about sharing with others. Some other metrics for your use. This is on average. And one of the things that really jumps out to me from this survey is the amount of turnover, the percentage of turnover overall, and the percentage of turnover in the first year. And what that says is the companies that participated in the survey have some work that they could do around their processes, because if their processes were finding the right person, the right fit, they wouldn't be experiencing such a high degree of turnover. And when you think about the nurse turnover at 32.8%, the costs associated with that, whether it be $1,800 an applicant or much higher, which is what I actually think it is, just the cost associated with that is telling me that there's some work that could be done, not only with the process, but something either went horribly wrong during the process in selecting the person or horribly wrong in the onboarding and orientation. So one of the other things that, I'm finding is very prevalent is you really, in the past, it was word of mouth around employee brand, around employee experience, and with the advent of social media, the word really travels. So as you're finding great clinicians, you're trying to set your processes, your messaging, everything you do around recruitment up to find the best and retain them, you have to be true to what your brand really is. So let's take an example. This is a healthcare organization, a quite large one. And what they tell their applicants is, joining our team means contributing to a legacy of quality, affordability, innovation, and service that spans decades. Here, integrated teams empower more than 9 million members to live up to their health potential. And this is what the candidate said. Was great, getting not to be so good. 10 hours of interviews and then nothing. Not even a thank you. Recruitment is a black hole. The recruiter and I played telephone tags for 3 days before I gave up. So there's a definite cost associated with the perception and the brand that you present to the world as it relates to how you go about finding and recruiting these clinicians. And it's becoming more and more prevalent. Here's some information from RecruitLoop and Beyond.com about technology trends. And you'll notice the uptick in the number of individuals in healthcare who are really using mobile apps. And they do not want to spend a lot of time entering information. They will not participate in a recruitment process if they can't do it on their mobile device, which is, a very impactful trend and something we really need to think about as we're thinking about our recruitment processes. So what should we do about our process? In this competitive recruitment environment, I think it bears to think about flipping the process around. And where it's been very candidate intensive, the candidates are doing a lot of the data entry, they're doing a lot of the work as it relates to getting information into a system and participating in lots of interviewing processes. The new recruitment process that will help you find the best clinicians and really engage the right ones in your process will be ones where the candidate is engaged in really high-value activities that features your brand, lets them get to know you as a real employer, what it's really like to work for you, and gives you the time to really look at, are they the right fit? In this scenario, the company would take a bigger role in entering data, meaning you may be entering a physician's CV into your system yourself or using a lower cost resource than in the old scenario where an applicant filled out the online application and they filled out a number of other forms and things. In order to thrive in this, what I think will be a very competitive environment, we're going to have to think about that process in a completely different way. And if you can do that, that will really enhance your brand to the right candidates. So here is an example of what a streamlined process could be. So using mobile data, mobile apps, have them enter their basic information, their name, their contact, maybe a little bit about their education, a little bit about what they want to do, and some basic information about their previous employment so you know whether or not it's someone you want to pursue. If it is someone you want to pursue, you want to know right away if they are a behavior and skill fit for your organization and can they meet the guidelines around accountable care. And you can do this through scientific assessments, and they don't need to be long. I've seen some that are 15 to 20 minutes that are really accurate. It's almost frightening how well they can pinpoint an individual's strengths, skills, abilities, likes, and dislikes. It's kind of uncanny. And early on in the process, they should be meeting key decision makers. Now, as recruiters, I think we do a great job of screening, but it has to be the right fit with the hiring manager, or all the screening and interviewing and pre-selecting that we do really means very little. So I think we've got to get the key decision makers involved early and often. And then because things are very different in our environment today, we need to know not only can they answer our questions and talk about the behaviors and skills that they have, can they actually perform in that way? Well, the best way to find that out is to really either use gamification, different games that assess their skills and abilities, or simulation. And that's when you really see, is the person able to do what they say they're able to do? And that streamlined process, if set up correctly, should let you know very quickly if you've got the right person. And if you don't, you can always give them off-ramps that, remove them from the process and help you focus your time on the individuals that really could meet your requirements. So things you can do right now. The mobile app piece is absolutely essential, and I think it's going to become even more essential. More people shop and do other things on their mobile devices than any other tool. This is here to stay. Don't ask your candidates to do data entry. You can outsource that. You can use other administrative resources to do that kind of work for them. Focus their time on getting to know you and you getting to know them. Use metrics to improve your process. So set your process up, know what your baseline measurements are, and as you tweak it and make changes, track the ones that are impactful and that are working for you. And finally, take a look at the different screening tools that are currently available. Again, they don't have to cost a lot of money. They don't have to take a lot of time, but they really can produce very accurate results for you in your recruitment process. So we talked a lot about some radical changes to processes, and some of the things that we do because we have to do them. We're either legally required to do them, or it's the change of making changes to the process will take some time, And so you ask yourself, so what is really the right process and how can I get there? Well, the right balance for you and your organization, either both culturally and from a time constraint perspective and cost-wise, is a process that's legally compliant and candidate friendly, and then it's equally balanced among those things. So what can you do to optimize your process today? There's lots of things that you can do, and we've been talking about them, but how do you really get there? So I put this roadmap together. I think that process improvements can be made fairly quickly, and it doesn't have to cost an arm and a leg. It doesn't have to take a long time, but here's some quick steps that you can go through. First of all, if you haven't mapped your process in a while, now would be a really good time to do it. Look for the number of steps. Look for redundancies. How many people are involved, and do we need as many people as perhaps we have? What is it costing us? And the most important thing to keep your eye on is, what do your applicants think? There's lots of ways to find this out. You can look at Glassdoor, and as I mentioned earlier, people are very vocal. They're vocal on Glassdoor and other social media outlets. So that's a great way to keep a pulse on, how you're doing. But you can ask your applicants. You can certainly ask new hires, or you can survey the applicants throughout the process. I've seen this done very well by a couple of different healthcare companies, and they simply send an email with a link to a survey. If people feel very strongly, believe me, they'll provide you with feedback, and it's great anecdotal feedback to have. So once you've done that, you should really look at your technology. And is your technology helping you, or is it getting in the way of you being successful? I know that many organizations have gone through HR transformation in the last few years in an effort to streamline their processes and incorporate updated HR systems. You want to maybe take another look at that. If you've had that HR transformation, or you're on the road, or you've passed that road, how many systems are you really using? How many interfaces do you need? Are you able to get the data that you want to drive improvements? How many hands are in the system? Because that's going to impact the validity of your data. How many people do you need to support it? And what do the candidates think about the technology that you're using? Again, don't overlook what the candidates think. And then you can make changes based on what you're seeing and what can be improved. Always keeping an eye on your brand. We've talked a little bit about this already. But, you can really find out a lot by not only social media, but what are your alumni saying about you? Key findings can be seen there. And so when you finally have all of this information and you take a look, what can you do in the short term? Well, can you shift data entry from the applicant to an internal resource? Can you eliminate steps from the process that are particularly confusing or duplicative? And, can you make those changes without spending a lot of money? And last but not least, are there new technologies that you can incorporate to enhance the experience? And so following this roadmap, taking these things into consideration on a regular basis will help you, again, be ahead of the competition as it relates to recruitment. So that's what I had for you today. Do we want to open it up for questions, Stephanie?
Yes, thank you, Jan. Before we move into Q&A, please take a moment to note the program ID number for today's webinar, ORG-program-162055. You will need this number when you apply for your recertification credit. It's also going to be on the certificate that we email out next week with the recording and the deck. And now let's get to questions. So I'm going to go back to slide 11 real quick, which is the slide that had all of the data on